Well, I would say it's a deep feeling of joy.
The people are incredibly appreciative.
It's enlightening. I mean, it's an awesome thing.
I think I'll take home with me the smiles of the people.
And coming here was like an eye-opener, and I think a life-changing experience for me.
All over the world, there are poor countries, undeveloped and developing countries, where there's a tremendous need for medical care, but particularly eye care. We can't say for certain that persons are going to have heart disease or lung disease or kidney disease, but we can absolutely say that every human being is going to have cataract and go blind from that if they live long enough. So there's an absolute need for eye care all around the world.
What is striking to me about Pacific Island countries like Tonga is their isolation and impoverishment and the medical needs that they have.
I was actually surprised that the government here and in other countries like this allow and seem to actually encourage groups like us to come in here, because it really exposes the inadequacies of their healthcare system. But on the other hand, I guess they're just so desperate for any kind of health care that they encourage folks like us to come in here.
It's a special opportunity that we have to come to countries like Tonga from the U.S. and to share what we have and to learn and share what the Tongans have to give back to us.
These people, I believe, often are happier than we are, and they've got so little by our materialistic standards. And yet they're very satisfied with what they have, and they're very happy, and they don't know that they're poor.
I got to see how I don't know if it's lucky, how spoiled we are, how much we have that we take for granted and don't really appreciate, and then still find reasons to be unhappy. And then here, how little they have and still how happy they are. It was a good lesson for me.
We had a unique opportunity on this trip to see two women before they had surgery, and then to see them after the successful surgery, where it was clear that it's not only the individual that benefits from what we do, but their families and in fact the entire community.
This lady has what we call white cataracts. What that means is when you look at my eyes, my pupils are black because the lens in my eye is totally clear and light gets through. Her pupils are totally white in both eyes. And what that means is no light enters her eye. She can't see my fingers a foot from her face. And as a result of that, she's functionally blind in both eyes.
And thank you so much for all of you guys. That she's the one of the people that you can make her see again. Thank you.
And the amazing part is, because the nature of the cataract and the way we fix it, I can restore to her normal vision in 10 minutes. It's a very technical fix. The surgery is very difficult. But yes, in 10 minutes, I can give this lady back the vision she had decades ago. I can make her see normally. And I can give her life back to her. And more importantly, I can give the 5-year-old freedom. He no longer has to help grandma around. He becomes a free kid. He may get into a little bit more trouble, but he'll enjoy a lot more.
Thank you.
When she always does the praying, she always prays for you guys.
And so giving back is something that is rewarding for the doctors that come, rewarding for us as well.
Meliani has 2 very large cataracts, one in each eye, and they're blinding cataracts.
So I'm a poor lady. I can't afford to pay for the doctors to do my eye surgery, and I'm begging you people to please donate to make it possible for these eye doctors to come and help the people of Tonga, because we are poor. We can't afford these expensive surgeries. Thank you.
You can see the cataracts right now because her pupils are dilated, and you can see that her eyes are white, and that white is the cataract, and the density of that cataract is so easy to appreciate. She can't see a thing through those cataracts, and so she's basically totally blind. So our plan is to operate on one of her eyes today and the other later in the week so that we can restore her vision and allow her to see her children again. The beginning of the healing will basically start. Can you open both eyes, will you?
Oh! Oh, woo! May God bless me.
God
Thank you very much. But now I can see properly. I do everything. I wash, I cook the food, I get the market, I do everything. Malo.
Okay.
Bye.
And I'd love to bring my kids out here and show them that, you know what, it's not about how much you have, it's about doing, about what you can do with what you have.
It felt really good. These people were in dire need.
I feel that, I would have liked to do more, do more surgery or see more patients in clinic. But as Dr. Vivili told me, he said, you should never go home feeling that way, because in the big picture, you really do make a big impact on the people.
It's been wonderful. To me, it's been very satisfying on all counts. We did cataract surgery and laser surgery on over 100 patients. We screened several hundred people for cataracts and diabetes and other eye diseases. We did minor surgery procedures. On a number of them, we gave out hundreds of pairs of glasses and sunglasses. So from the standpoint of service, it was terrific. It's the best we've ever done in a short time.
It's important for people who give to know that giving to an organization like the Hawaiian Eye Foundation does not go to waste. The work that they do is very good work, and the work that they do makes tangible differences.
One thing we can all do in our lifetimes is to try to leave the world a better place than when we arrived. Leave it happier or cleaner or in some way better. And I try to get this message to would-be volunteers or donors that you can, in fact, through very little effort, leave the world a better place. And volunteer missions like this are certainly a way for any physician to make a big change in the world in a short time, with very little effort, and get back so much joy.